Ciao mondo, hello world, hola mundo, hello monde, konnichiwa, ni hao, namaste. We're here today taking a cappuccino with Professor Stefano Romagnoli from the University of Florence and the Department of Anesthesiology, Intensive Care and Pain Relief. And in particular, we are debating together at this course we are holding in Vicenza on AKI and CRRT for nurses and young doctors about the collaboration between intensivists and nephrologists at the bedside of the critically ill patient. So Stefano, what are your take-home messages from this course and what is your vision about this collaboration?
Hello everyone. Thank you, Professor Ronco, for this important topic. It's my personal opinion that it's absolutely necessary to collaborate, but it's my opinion that at least in most of the cases, in most of the hospitals, this is still an unmet need. We have to work together much more than what we are doing now. We are working on that. We have to start with our School of Anesthesia and Critical Care and School of Nephrology. So we have to start at the beginning, and then we have to follow the patients starting in the ICU, then following together after the ICU discharge. Because it has been demonstrated that following patient after acute kidney injury by nephrologists eventually improve outcomes.
So I think that this kind of collaboration not only is needed, but is somehow a kind of a mandatory approach, because there is a kind of a competence that is between nephrologists and intensivists that can be common, but also we can add to this general competence specific competencies from nephrology and intensive care. So especially for extracorporeal therapies, this would be the most important aspect. We started that many years ago with the editorial with Rinaldo Bellomo on the concept that critical care nephrology, the time was come, but as you mentioned, probably not everywhere this has been implemented. How about in Florence? Did you?
In Florence, we are working on that. We have a very good relationship with the head of the School of Nephrology, and so we started this route together. It's absolutely necessary to share experience, to share conditions of our patients, and to improve care by using the expertise of the specialist who is the nephrologist. So it's important also for my specific category of physicians to open the mind and to use the knowledge of our colleagues nephrologists. In Florence, we are working on that. We are doing some steps forward, but we have a lot of work to do.
Yeah, the common ground is acute kidney injury, sepsis, and the therapies that more and more seems to be important to relieve some of the conditions, such as the cytokine release syndrome, for example. But more than that, seems to be or to find the rationale in protection of organs to avoid further development of multiple organ failure. With this, thank you very much for joining today Cappuccino. It has been a pleasure sharing the Cappuccino with Professor Stefano Romagnoli, and have a wonderful day. Excellent.